Okay, so you really want this IUD. Both the contraceptive effectiveness and the benefits that we get besides contraception are the thing that you're really looking for in your choice of method. But you're super worried about the discomfort that you might feel at the time of insertion. Let's talk about what we can do. Now, for some people, they don't need any additional sedation, and just taking some ibuprofen, Aleve, Motrin, Midol, a couple of minutes, an hour before their procedure is sufficient for them to have an experience that is acceptable and tolerable to them. For other people, they need a little something extra. Sometimes we can give a medicine by pill to help reduce people's anxiety, but there are still people who need even more than that. There are people for a variety of reasons who would really benefit from some medicine through an IV, what we call IV sedation or moderate sedation. For those folks, the process looks a little different. You might be in the office for an additional amount of time, but the good news is you will get your IUD in a way, in an experience that best suits what your needs are. So how do we do that? You'd come into that office, and the first thing we would do is just make sure that we understand your medical history. Make sure that we understand what sedation is right for you, what level of sedation and what kind of medicines would best serve you. Then we will start your IV. That's a little plastic tube that goes into one of the veins in your arm or your hand. The next thing we'll do is go ahead and bring you back to that exam room. We won't start any part of the procedure until you are nice and comfortable. I often tell people that moderate sedation is a combination of a couple of really nice side effects. You're going to feel less anxious, you're going to feel a little bit sleepy, and you might even feel a little bit like you're in the twilight zone. So even though you hear us talking to you, you don't really care so much about what we're saying. Once we get you nice and comfortable, then we're going to start with the process. We're going to do a pelvic exam, understand the size and direction of your uterus, place that speculum, and then go ahead and place that IUD. Everything comes out before we start to help you wake up, and then you're going to stay with us for another probably 30 minutes or so as we let that medicine wear off. The nice benefit of moderate sedation is folks feel really comfortable, and for many people, they don't even remember the experience of their IUD insertion. Remember, choosing your birth control method and getting an IUD should feel empowering. It shouldn't feel like a traumatizing experience. So if a higher level of sedation is what you think you need, please talk to your provider. There are places where we can offer you that option, and you can walk out with the method that is best for you.